Kia ora tātou. I'd like to just start by acknowledging Jane George, who has kindly agreed to be our MC today, but who was also so generous with her time and her thoughts on the Ministry's rural workforce work, which I'll talk about shortly. So thank you very much, Jane. And just to acknowledge two members of my directorate who are here, Eloise Horn in the corner. Eloise is the engine room that keeps the directorate humming, so if you get in touch with us or you attend anything we do, it's Eloise who organises that. And Amy Wilson down the back, who's the new General Manager, Policy and Insights. So this is Amy's week 4, so save all your really tricky questions for her afterwards. So, thank you, Judy, for discussing the HWAB. Maybe that sticks a bit better, but we had the first board meeting on Friday, and I left feeling incredibly excited and optimistic, and it's not often you say that after an all-day board meeting on a Friday. I think that we're incredibly fortunate that we have such a diverse and intelligent range of people on the board who are really committed to making a difference for the health workforce in New Zealand. And I know I'm really excited about working with them. I know that they will test us and they will hold us to account, and we're really looking forward to that. So I started at the Ministry just over 4 months ago, and one of the first things that I did as part of a broader Ministry restructure was look at the structure of my directorate. And what I thought I would do is just briefly run you through it so you get a good idea of who's who and who would maybe be the best person for you to talk to or contact depending on whatever issue is pressing or what you want to discuss. So there's a new role in the team called Chief Advisor Workforce Equity, and that role has a focus on ensuring that our health workforce reflects the diversities of the communities that we serve. And it's a wee bit of a unique role in that it's focused on the sector and not just on clinical roles, but on roles across the health system. But it also has a focus within the Ministry. Because in the Ministry, we really firmly believe that we can't ask the sector to be diverse if we don't reflect that ourselves. And we also make some really important policy and funding decisions, and these decisions really need to be founded in diversity of thought. There's the Policy and Insights team that Amy leads, and this team brings together the policy function with our data and analytics function. And the reason for that is ensuring that we have a really strong evidence base for our policy. And sitting in that team is also a program manager who's responsible for the Mental Health and Workforce Addiction Plan, which is basically giving effect to the government's investment in mental health and addiction workforce from Budget 19. And probably one of the big changes sitting in that team is with data. I'm really wanting to drive a focus on data across the health workforce. At the moment, we get great data from the regulatory authorities, so we can tell you a lot about our regulated workforce, but we need to expand our data sources to cover the unregulated workforces and our kaiwhina workforces. So that's a real focus of Amy's work program. There's the Health Workforce Commissioning team, so we administer about $220 million annually investment in health workforce training and education, generally at a postgraduate level. So that's the team that manages that funding on behalf of the Ministry. There's a sector engagement and implementation team, and this is a new team. So when I started, one of the main pieces of feedback I got was that health workforce in the past had some great ideas but hadn't always delivered on them. So this team's role is to make sure that we do that. It's to make sure that when we come up with policy and ideas that we actually follow through with those, and that what we ask you to do is actually practicable and easy to implement. So that's the team that will be leading that work, and there's also an engagement role in there to help us communicate effectively with you all about what we do, but also to help you communicate with us, because another key piece of feedback I had was that There's lots of amazing stuff happening out in the sector already, and we don't need to reinvent the wheel. So this role's about getting that intelligence back into us so that we can talk to you about it, we can harness it, we can use that really well. And then finally, there's the employment relations team. So people may think, why is the ER team sitting in with the workforce team? So this is the team that oversees the DHB's bargaining, and one of the rationale for putting it into the Workforce Directorate was because it's a really important lever for workforce strategy and outcomes and aims. And we need to make sure that our ER strategies and our workforce strategies are aligned. So just prior to starting in the role, the Directorate held a hui at Te Papa to discuss the strategic priorities for the health workforce. And a really strong bit of feedback there was, actually, you can't ask us to rank our workforce priorities one above the other because they're all important. And it's like asking a parent to choose a favourite child. So what we did was work further with some reference groups from attendees to think about what are the strategic opportunities for the health workforce, and where should we be focusing on. And we landed on the 7 workforce strategic opportunities up on the screen in front of you, and they're our focus areas and also the focus areas for DHBs as well. The first one is growing the Māori health and disability workforce and creating environments in which Māori can thrive. And Jo will allude to this a wee bit later when she talks. It's about making sure that, as well as recruiting people into the workforces, we actually create environments where they feel safe, where they feel welcomed, and where they can bring their all to their work. Growing the Pacific health and disability workforce is also another priority for us. Wellbeing of the health and disability workforce is another strategic objective. And this is about making sure that we have workplaces where people feel safe, physically and emotionally, where if we can create a workforce or an environment that people want to be part of and a culture that they want to be part of, it helps us to recruit our workforce, it helps us to retain them, and it also helps as we move through change. The health system's changing rapidly, and in having an environment and a culture where people feel able to safely adapt is an important part of that. The next one is around interdisciplinary learning and strengthening shared skills and values across professions and working better at teams across the system. And Sue's going to give you a really good example of a program that the Ministry helps fund that looks at interdisciplinary learning shortly. Data and intelligence is a really key priority and objective for us. I mentioned earlier that it's an aim of mine to get a much more coherent data set on the health workforce, and I have a goal where we'll be we're guardians of that data but not the owners, and we'll be able to share it with the system so that you too can access it to help with your workforce planning and strategy. Leadership is key. Obviously, it was a key theme coming out of the interim health and disability system review, and it's also one of our priorities. How do we ensure consistent and common leadership pathways across the health system for all leaders, not just clinical leaders? And finally, ensuring a sustainable rural health workforce, which I'll talk more on shortly. Once we sort of landed on those strategic objectives, what we did was pull together all the work we're aware of that's happening across the sector and map it against each strategic objective. The reason for doing this was to identify where perhaps there are gaps, where we in the Ministry should focus, where there's already great things going on that we can support or facilitate, and really to bring together that overall picture of workforce development happening across the system. So that work's nearly complete, and I hope to be able to update everybody on that in the early new year. Another thing that came out of the hui, which pleases me and my geeky policy heart, is we've got a framework for thinking about workforce. So this is just a common way that we think about workforce, and I call it the 4 C's. So it's capability, making sure that we have the skills that we need now, but also in the future. Capacity, which is about having the right people in the right places. Culture, and that's looking at supporting the wellness of the health workforce, but also having a working environment and a system that people want to work in, that they identify with and they feel engaged and connected to. And it's also looking at how changes in technology will impact on the workforce in the future. And then finally, criticality, which is about responding to critical workforce shortages and issues. We can get quite focused on the long term, but there's vulnerable workforces and issues that we need to be addressing in the now. So that's just a simple way that my directorate is beginning to think about workforce and the lens that it's applying to all of our work. So you'll be pleased to know that we do actually already have things underway as well. We haven't just been developing frameworks and objectives. So there was a development fund that some of you may be aware of, and I'm pleased to say that 5 initiatives have been funded through that to a value of $9 million over 3 years, and an announcement on those will be made very, very shortly. We've also done some work on the rural workforce as well. We're in the process of developing a rural medium-term plan which focuses on technology as an enabler, interprofessional learning, scaling up local innovation, so again reflecting on what's actually already working well in the system and how can we help that, and developing the future rural health workforce. While that work's underway, there's also some short-term initiatives that we have going. We're currently scoping interprofessional rural learning hubs. So we've engaged Supere, and they're currently out there talking to stakeholders from across the health system about rural learning hubs, what they could look like, where they could be located, how much they'll cost, what they'll do, and I'm really excited about that work, and we hope that the plan is that scoping phase will be finished sort of mid-November. We're funding a 3rd rural immersion program in the South Island. So we have 2 in the North Island and we're funding a 3rd in the South Island. I won't say too much more about what the rural immersion sites do because Sue's going to talk about the one that the University of Otago runs. And we're also funding the employment costs for 4 nurse practitioners for 2 years in rural locations. So we see this as a really excellent opportunity to help develop the nurse practitioner role and showcase how it can work best and support rural communities. So what's next? We're currently going through a building stage in the directorate. Our FTE has gone from 26 up to about 43, so there's a lot of recruitment out there going on. So if you know anyone who wants to work in health workforce, come and see me afterwards. And we're beginning to think about the strategic longer-term work program that we're going to put in place, which is why we're so excited to have the Health Workforce Advisory Board up and running. I think the other key thing that I would say is we're really keen to continue to engage with people from across the system. So we only know what we know, and we know that there's some amazing, fantastic things happening out there already. So please do come and tell us about that. We want to work with you. There's only so much that we can do from Wellington, and we know that there's fantastic things happening out there already that we want to know about and want to continue to help with. So a really good example of an initiative is the Rural GP Networks program where they take young medical students and travel around secondary schools in rural areas to help introduce rural kids to rural health careers. And so that's a really cool kind of thing we want to know about, we want to help about, and we want to engage with you about. Thank you.